Welcome to the Capstone presentation for the Masters in Community Development Program. My name is Sanjeev Sharma. I am the advisor and I was involved with the admissions at the Carsey School. And I'm the advisor for these students that you will be hearing from very shortly. As the academic advisor and also the Capstone, the project series advisor in the project series along with Jolan. So this is one of the most exciting days of the entire program because we've been telling we know what the students have gone through, the amount of effort where they started. So it's a celebration of their achievements and what they've been able to. So it's a very proud moment for us as well. So with that, I know we have Michael Swack. He is the director of the Center for Impact Finance at the Carsey School and the founder of this program and the director of the Masters in Community Development. So I'd like to have Michael just kind of introduce or say a few words, opening remarks, after which Jolan will provide some feedback or the background information. Thank you.
Yeah, I'm not going to take long. I just want to congratulate the presenters today and thank you, Sanjeev and Jolan, for being such great advisors, supporters, and really just the key elements to making this program work. Congratulations to everyone who's presenting today. I'm really looking forward to the presentations and promise I'll ask some questions. So with that, Jolan, I'm going to turn it over to you so we can get started.
Thank you, Michael. Thanks, Sanjeev. Good afternoon, everyone, especially to the students, to your family, friends, and colleagues. So as Sanjeev said, this is like one of the best days we have in the project course series because it's an opportunity for the program and the students to share all of the efforts they've done over 9 months. So just a little bit of a background on the presentations that you'll be listening to. I would like to just give a little bit of a set of information about the Capstone project. So it is actually a platform for students to learn and apply knowledge and skills in various elements of development projects. So all students in the program can graduate only if they are able to develop a capstone project. So what's this capstone project? It is something that is focused on a defined community. It's either a shared space, neighbors, or folks that come together online, a shared interest. For example, they have a certain issue that they're trying to resolve, or they're promoting a certain set of group interests or a shared identity, perhaps women in the labor force, etc. Okay. At the same time, the project revolves around providing support to communities that are, for the most part, either vulnerable or marginalized, or working with organizations that serve marginalized or vulnerable groups. This could be vulnerability or marginalization in various ways. It could be economic, like low-income folks, social, perhaps in terms of like gender, or perhaps people with disabilities, etc. And it's important to note, folks, that the students are responsible for identifying the community, identifying project participants and partner organizations, as well as securing project resources and budgets. Okay, so it's not like as if they're given a set of resources. It's actually part of the challenge, and hopefully, the excitement of the journey. Just to highlight the fact that it's not just merely designing something, it actually is negotiating with groups, etc., for them to be able to end up with a capstone project. And that's why we encourage students to work with organizations that they're currently linked with. Either they work for them, they know them, etc. But sometimes, students choose to do something else. And the MCD program in Carsey encourages them to do so, because in real life, isn't it? Sometimes there are burning issues that need to be attended to or addressed even without an organization to start with. So you will see examples of this in the 6 presentations that we'll be listening to this afternoon. And the students have 9 months. Obviously, 9 months is not enough to create change, especially in vulnerable communities, especially if we would like to engage them in the change process itself. But because this is part of an academic program, they're restricted to what they can do within 9 months, knowing that they can proceed and continue with the efforts that they have beyond the 9 months. So as you know, there are a lot of challenges, constraints, limitations, etc. But the folks that you'll be listening to right now made a lot of effort to be able to design a project and attempt to implement the activities of the project. So hopefully, you will learn from them, because they definitely are excited to share things with you. Well, despite the fact that there's been a lot of hard work they've done, this is not the first time. In reality, in the past 12 years that the program has existed, a bunch of projects already have been developed and presented, starting from as far as Alaska to Yap Island in the Pacific Ocean and everything in between. Okay, there have been 123 community development projects that were presented as capstones by our students. Okay? And there are 6 more this year. There are 3 from New Hampshire, 1 from Haiti, 1 in New Jersey, and 1 in the Democratic Republic of Congo. So these are folks, these 6 presenters actually went through 4 courses. These are the ones in green. 4 courses starting August in 2022 and culminating today. And the ones in red text are the different processes of the development process, from conceptualization or developing the project idea to what we're doing now, which is presenting the results of their project. So here's just a visual of what they went through. Their pre-project activities, which is coming up with a project idea, contextualizing it in the community, understanding the problem through various research processes that they went through. So they just didn't sit down in class and listen to each other. They actually had to identify a community and do a lot of research before they can even claim to have designed a project. So once the project is designed, then if it's possible, they go on with the implementation and monitoring of the project, given the limited amount of time that they have, as in 9 months. And none of them were able to fully implement their project, so none of them were able to evaluate it. Nonetheless, we still ask them to develop an evaluation plan. So this is the gamut of activities that students have gone through, or topics that the students have gone through, accompanied by assignments, at least 32 assignments done over times. And end of the day, we had 9 students at the start. Of these 9 students, 6 of them are presenting today. 1 student will present later as in maybe next week or next few months, and 2 are on leave. Of those 6 who are presenting today, 3 of them actually have a final project that they're presenting today that is very similar to what they started with. That said, there were 2 students who are presenting final projects today that are somewhat similar, not really the same, a little bit of changes here and there to what they initially thought were their project. And there was 1 student who actually had to totally come up with a new project during the 2nd semester. Again, of the 6 students who are going to present today, 1 student was able to implement almost all of their project activities. 3 students were able to implement some of the project activities and the project ideas, that should say activities, and 2 actually were not able to implement, and they'll tell you why. And the students' presentations will be a sharing of the results and learnings that they've had, as well as a celebration of all the work that they have done. Each student presentation is about 10 minutes, and these are pre-recorded presentations, okay? So we ask them to do a recording. We will play the recording now, and then after each person presents through a recording, we will then come up live, and the student is going to answer questions first, Michael Swack and other faculty, and then open it to others. If you have any questions, please wait for the presentation to be over for the specific student and take note of the slide number so that it's easier for the student to be able to know exactly what you're referring to in your question. And then there are various capstone project types, as you could see here, from transitioning to independent housing, to participation in peace building efforts, access to education to improve employment, and coordination and communication to improve community or organizational services in various contexts and set of groups. Okay, New Hampshire, Vermont, Haiti, the Republic of Congo, Democratic Republic of the Congo, New Jersey, and again in New Hampshire. So we will start with Madison, who had a project idea, and this is exactly what she submitted. This is assignment number 3, I think, in the first course, on transitioning folks with intellectual and developmental disabilities through housing in New Hampshire. So I am now going to play Madison's recording.
For my capstone project, I focused on transition planning and beyond for individuals with intellectual and developmental disabilities in the Conway area. I will also refer to the larger Carroll County, the Mount Washington Valley, Region 1, as well as the state of New Hampshire. I stumbled upon this project by accident. Working as the Director of Administration and Programming at the Laura Mahoney Autism and Epilepsy Foundation, I provide free services to people on the spectrum from ages 2 all the way to 66. With such a wide age range, I've seen individuals through all steps of the transition process. And at the high school and young adult levels, I was being asked questions by parents, where will my child go when I die? Unfortunately, as it stands right now, the problem of where will my child go when I die can be broken down into 2 statements. The first, about individuals with disabilities not transitioning into housing independent of their caregivers, and inconsistent service provision. Unfortunately, if these issues continue unaddressed, families will not know how to transition plan. They won't have access to financial and transition resources. They won't know their own rights or have the ability to gain community membership or find appropriate housing. To visualize the problem, this map shows an uneven dispersion of services by area agency. The top purple-blue color represents Northern Human Services. As you can see, it covers a disproportionately large area compared to the other 9 nonprofits that fall under the Bureau of Disability Services. To further this, in a study done by the Department of Health and Public Services, Conway was found to fall into category 5, meaning that it is in the highest need of prevention services, community resources, and supports. The various problems that lead to this issue of having nowhere for adults with disabilities to go starts with financial resources. It goes on to transition planning at the high school level, the lack of services once students reach anywhere between the ages of 18 and 22, no opportunities for community membership or employment. Along with this, a lot of individuals don't know their own rights. There is no current housing available, and therefore individuals with disabilities can't move forward to live independently. Many remain with their guardians long after they graduate from high school. To further visualize and give context to the extent of these issues, 1 in 5 New Hampshire adults have a disability. 8.8% of people under 65 in Carroll County also have a disability. Surprisingly, 19.8% of the Conway population lives below the poverty line. This is staggering when compared to the state average as well as the national average. Region 1, served by Northern Human Services, disproportionately serves 57 towns, being marginally followed by Region 5, serving only 35. The remaining 8 area agencies serve less than 25 towns each. Furthermore, 24% of caregivers are 60 years old or older. And finally, 70% of people with disabilities experience abuse, as opposed to 30% of the neurotypical population. In addition to this, people with disabilities are 3 times more likely to experience domestic violence or sexual assault. Leading up to the project in the design and planning phase, I conducted several focus group discussions, key informant interviews, a town-based housing survey, an observation, as well as literature reviews and secondary data reviews. The outcomes of the project were as follows. First, I focused on the short-term outcomes. There are 7 of them for disability rights, lack of transition planning knowledge, transition planning resources, financial resources, community engagement and employment, as well as appropriate housing, and really emphasizing interagency communication. This lets you the intermediate outcomes of knowing how to transition plan and consistent service provision, which would ultimately lead to the long-term outcome of adults with intellectual and developmental disabilities living self-determined lives to live independently. I color-coded the outputs here. As you can see, they followed the short-term outcomes. For example, in disability law knowledge, I conducted a disability law information session, partnering with 2 attorneys that specialize in such a topic, to talk about access to financial resources. I'm doing financial resource information sessions, as well as assisted application sessions for public benefits such as Social Security and Medicaid. To give you an idea of just how much had to go into the activities that led to these outputs, I focused on the activity of coordinating with facilitators, guest speakers, and reserving the event space. As you can see, starting with inputs, I had parent group time, marketing costs, volunteer time, facilitator compensation, venue costs, even refreshments. Those inputs came from various sources, which I was then able to come to the conclusion of coordinating these events. To give you an idea of the timeline of the project, I'll focus on the top 2 lines here of the disability law information session and the transition planning guide, which is still currently in process. The disability law information session was held on January 15th. However, there was marketing beforehand, evaluation afterwards, and several months in advance, contact and collaboration with the disability rights attorneys. For the transition planning guide, as it is ongoing, I work with Laura Foundation families to identify where the gaps were happening in transition planning. So we are currently in the process of gathering and culling through content that has been provided by local school districts or the area agency, as well as public benefit resources. As you can see, there is a lot still to come for this project that we are really looking forward to accomplishing. To really put emphasis on what has come of this project, we have had the following 7 outputs. So first, we held the disability law information session. We are in the process of developing a transition planning guide for Region 1 specifically. We are also having area agency representatives and other organizational representatives come and speak to the parent group at the Laura Foundation. We are in the development process of both an overnight respite program and a high school level self-advocacy program. And finally, we hold regular movie nights and we'll be holding a community dance at the Laura Foundation come this July. Looking at the project, I wanted to analyze the strengths, weaknesses, opportunities, and threats that were both internal and external. This is something that can be focused on offline. Finally, Some of the most important takeaways that I had from this project were first, to create all of my evaluations tools early. I learned this in the disability law information session. To be patient and flexible. I found that rarely things go as we plan them to. To conduct the evaluations at the event rather than afterwards. I also learned to document all of the communication I had with stakeholders, partners, as well as participants. Since there are so many moving aspects, documenting this communication made it easier to look back to and make steps moving forward as they were informed. Finally, the two biggest takeaways were to ask why. This was actually something one of my key informants, Harrison Kanzler, had recommended I do, that sometimes the wheel is broken and to ask why we're still using it. And finally, to be kind and to remember your own why. To me, I kept going back to the question, where will my child go when I die? I am still working to create a solution. Thank you.
Thanks so much, Madison, for your very thought-provoking and comprehensive presentation of your capstone project. We are now going to open the floor to questions, starting with Michael. And then after that, we're going to be asking, the other audience members if you have any questions for Madison. Go ahead, Michael.
Well, thanks, Madison. It's really an impressive project. The project results, what you went through. My question has to do with where you'd like to end up. That is, are there any model best programs that you looked at where they actually do this well? And how could this work if people were actually committed to doing it the right way? So who's doing it and how do they do it, I guess, is the question.
Thanks, Michael. So there were a couple of models. The long-term project is to develop housing specifically for this population. The models that I really focused on, one was Sweetwater Spectrum, which is out in Sonoma, California. They were actually part of a focus group discussion that I was involved in. They started the model because they also wanted an alternative to institutionalized living for people with disabilities. And when I spoke with them, I found that one of the key things that led to their development was true integration into the community. So they were involved with city planners. They had them involved in the development of the actual facility itself. On the East Coast, there's actually Visions for Creative Housing Solutions here in New Hampshire, and they're another wonderful model that really integrates people into the community and make sure that they are both simultaneously being involved, right? Finding jobs, being able to engage in community activities, but also having a safe and supported place to live. So making sure that you have families involved of the people who will be living there, as well as community members, especially like city planners, public benefits people, just making sure that anyone who has to share contact with this population are involved in the process.
Is the major impediment to doing that financial resources? Is that why it isn't happening?
Absolutely. So I wouldn't necessarily say it's super lucrative to develop housing for people with disabilities. In Conway, we have a lot of development happening with shorter term rentals, which they're actually trying to get away from, but we do have several hotels being built regardless. So things along those lines, when you look at what your intention is versus what you are looking to get out of it, seems to be one of the root causes as to why something like this isn't happening more widespread.
Thank you.
Thanks, Michael. We now would like to open the floor to other folks who would like to ask Madison questions or even, make comments about her presentation. As she said, learning number 6, please be kind. So Sanjeev, are they able to, our folks be able to, Mahmoud?
Yes. Mohammed Saul, yes, I just asked you to, allowed you to ask a question. Go ahead.
Hello, Madison. Thank you for your impressive presentation. I was kind of surprised the caregiver age range from 65 going around the 65 age, correct me if I'm wrong. But I was also wondering, are there any incentives to recruit younger caregivers as the caregivers are getting older and older? Thank God they are doing a relatively good job, but how do you, are there any incentive to get more younger caregivers involved with to support the population in need?
Thanks for the question. So right now, in my experience, it's been very challenging to find younger caregivers. Our area agency, for example, they are very short-staffed to the point where some of the higher up staff are actually having to pull shifts in the residences. So finding caregivers that are below the age of 60 is challenging. Primarily, people reside with elders because they're their own family members. And if they were to go to a foster family or something like that, oftentimes the caregivers are also older. As far as I know, there hasn't been a lot of incentivization of younger people stepping up to the plate. However, there are programs where younger, say, couples or younger individuals can actually become certified home care providers, where they can take an individual into their house, they can live with them, and they do receive a certain extent of a stipend. But even then, from what I have found, a lot of them are also older. So we're working on it, but thank you for the question.
Thanks, Mahmoud. There's a typed in question here by Rachel Walson. Do you find that the parents of such individuals reluctant to have their loved ones placed in a facility like that?
Yeah, so definitely there is a push to step away from institutionalization for New Hampshire. It was actually one of the first states, it actually may have been the very first state to have deinstitutionalized people with developmental disabilities. They are reluctant for sure, just kind of like any other parent, to let anyone else take care of their kids, but even more so when they have such specialized needs. There has to be a lot of trust, a lot of communication, a lot of transparency. And when it comes to facilities, we try and stay away from that word, and we prefer to try and frame it as community-based housing, things along those lines, because then that gets us to further step away from it being institutionalized or actually be feeling like a group home setting. Thank you.
Thanks, Madison. Hopefully you were able to answer the question, right? And then we have another question, actually. This will be the last one. Noting that towards the end, if we have time, we'll open it to like a general forum. Go ahead, Amy.
Oh, hi. So my name's Amy Mahoney, and I actually know Madison. The place where she works, I founded the nonprofit, and that was so good. Madison, I learned things about our community I did not know. But I actually have a 21-year-old son, and he is in a school in Massachusetts, and it goes into adulthood. And as it stands, like some of the things Madison touched on, we don't have the staffing in our region of New Hampshire, or really anywhere in New Hampshire, to take care of people like my son. He is 6'4", he is autistic, he has breakthrough seizures, and he's nonverbal. So he has a lot going on, and Madison knows this better than anybody. There is no, and I don't want to use the word facility, but there are no community houses. There are no community placements that could take care of him. And the only place that at one point probably could have was Crotchet Mountain School. And I will say it very openly here, he was abused there. So we have a big problem in New Hampshire. And Madison, I'm so happy that you have done this project. And I'm definitely going to be using some of your information when I speak with the governor again, because it's really good.
Thanks, Amy.
I was like, wow, like just the statistics in Conway are staggering. So maybe he can figure the problem out for me now that I have more data. Yeah.
Thanks so much, Amy. In fact, Madison has conducted a comprehensive literature review in a very limited amount of time. And this is what Jim and I and the MCD program and Carsey are very appreciative of our students, Madison included, because in the limited amount of time, they're able to produce a lot. And it's not as if like Madison is a full-time student. It's not as if we actually have provided assistance for her to be able to run a project, but this is on their own time, on their own resources and volition. And so you could see the complexity and the amount of work put in by students in their projects are a testament to their dedication to, what is good for our communities. So with that said, thank you, Amy, and thank you, Madison. In the interest of time, I will now move on to our second presenter, knowing that we will have the opportunity, hopefully towards the end, to have more questions or more comments to our presenters, not only to those who are currently presenting. So I am going to share my screen again because I am now going to play the recording of Rebecca's presentation.
Hi, my name is Rebecca Waugh, and my capstone project is entitled A Development Approach to Addressing Mental Health Care Access in the Upper Valley. The Upper Valley is an area that makes up part of the Connecticut River Valley spread across Vermont and New Hampshire. While this area does cover 2 states, it is relatively rural, with many community residents experiencing social determinant of health-related needs, including food insecurity, housing insecurity, and financial difficulties. Residents within the Upper Valley are served by the main healthcare institution in the area and the only academic healthcare institution in the state of New Hampshire, Dartmouth Health. Dartmouth Health ultimately serves around 1.9 million patients. With the shift from manufacturing from the area around 50 years ago and the growth of this academic health institution, there has been a shift in the median household income within the Upper Valley. The highest median household income within the Upper Valley is located in Hanover, New Hampshire. This one city has a household income that is almost 3 times higher than the lowest income communities within the Upper Valley of Dorchester, New Hampshire, and Fairleigh, Vermont. Throughout the COVID-19 pandemic, the issues faced by Upper Valley residents became even more prevalent. Like many individuals in the Upper Valley, New Hampshire, and the United States as a whole, I have a mental illness and have faced barriers to accessing and maintaining access to mental health care. In my personal experience, financial barriers, including high out-of-pocket rates and no out-of-network benefits to allow for a reimbursement for care, have typically been the main barriers that I've faced that have prevented my access. On top of my own experiences, I also have family members with mental illness who have faced barriers to accessing and maintaining access to mental health care and have firsthand experience working in professional roles with the community residents struggling with social determinant of health-related needs to find and access the mental health care that they need. While resources in the community may exist to try to help residents meet their needs and connect for care, they may not always be accessible. During the COVID-19 pandemic, the need for mental and physical health care. In order to show that these problems were faced by individuals within the Upper Valley, I completed a document review going through the Dartmouth Health-sponsored Community Needs Assessment of 2021, key informant interviews with Ava Elson, Dr. Marella Maggi, Barbara Farnsworth, and Victoria Dobrievsky, and I completed a survey that was distributed through Qualtrics. The survey that I was able to distribute to community residents through Qualtrics was a 9-question survey. Through this survey, it asked general demographic questions, including zip code of the area that the resident resides in, respondent age, whether the respondent is currently accessing mental health care treatment, what that modality of treatment is, whether there have been barriers faced to accessing care and what those barriers might be, whether they've utilized emergency mental health care services and how frequently those emergency mental health care services are utilized, as well as if there was something that could be changed about accessing mental health care within the community, what would that change be? In total, I received 90 surveys, with 70 of those surveys being fully completed. These surveys were used in addition to the data collected from the Community Health Needs Assessment Document Review in 2021. The findings of my survey were consistent with the findings of the Dartmouth Health-sponsored Community Needs Assessment. With the completed research activities and the data that I was able to collect through the Qualtrics survey given to community residents, I was able to use my capstone to identify the need for and have created an initial design for a development project to assist with bridging the care gap within the Upper Valley for mental health care. Through my capstone project, I completed an original logic model with outcomes, including 3 causes, 2 intermediate outcomes, 1 long-term outcome, and 3 short-term outcomes. With the original logic model, I was able to create short-term outcomes, outputs, activities, and inputs for each of the short-term outcomes associated with the development project. The second short-term outcome associated with the project, I was able to come up with 2 outputs, several activities, and several inputs. For the third short-term outcome in the original logic model, I was able to create an output, several activities, and inputs for this outcome. While my development project was not able to be implemented, I still created a timeline regarding each activity, each short-term outcome from the original logic model. Additionally, I was able to complete a SWOT and stakeholder analysis included on this slide. While my development project was not able to be implemented within the community, I was able to complete a monitoring plan with updates on my progress. In addition to the monitoring plan being created, I also was able to create an evaluation plan. As previously mentioned, I was not able to implement my development project within the community due to several resource and time-related constraints. One reason is that the organization that I partnered with, creating the fund within the community, is a relatively new organization. With this new organization, there are outside commitments of organization members not allowing for full time to be spent on this organization. Additionally, with being a new organization, there are funding concerns. On top of this, the time and resource commitments became too much to be able to fully implement this development project within the community. Although this development project was not able to be implemented, I instead was able to develop a grant proposal for potential implementation with this fund in the near future. There are several outcomes associated with creating a grant proposal that would be able to provide financial assistance for accessing mental health care service to community residents within the Upper Valley. A short-term outcome includes the availability of resources to cope with the high cost of services and the low insurance reimbursement received by individuals receiving care. 2 intermediate outcomes include the individuals in the Upper Valley accessing preventative and regular mental health care, as well as a decreased number of individuals in the Upper Valley using emergency mental health care services at a high rate. For long-term outcomes of the grant proposal would be individuals within the Upper Valley continuing to engage in mental health care and neuropsychological and psychoeducational evaluations, as well as an experienced decreased burnout among healthcare staff due to lessened demand for emergency-related mental health care services. Through my development capstone, I think that there are several learnings and key takeaways that I was able to gain from this experience. A main learning lesson throughout this process is that development really takes time, communication, organization, and dedication. This is something that should be well thought through and researched to determine that a problem actually exists within a community. This is also an evolving process that can change. While you have one plan for the development project from the get-go, this process is evolving with input from community residents and team members going through. While I was not able to implement my project, my advice for others who are not able to implement theirs is to understand that implementing may not always happen. Additionally, it's best to start coordinating with team members through the development process before moving through any of the activities to make sure that an understanding is given regarding team members and their commitments through the development process. With the experiences gained throughout the designing, planning, and not necessarily the implementation of my project, are really regarding the importance of the development process as a whole, and really the commitment that you have to your community, the research to put in, and the interest regarding the development project. I would not have been able to obtain the information obtained through my development project without those listed on the works cited page. Additionally, this would not have been possible without the input from practitioners, community members, and other individuals in the Upper Valley regarding their experiences with mental health care. I'm super grateful for everyone who I was able to connect with during this project, including Ava Elson, Barbara Farnsworth, as well as the rest of the team behind the Community Health Needs Assessment, Dr. Morella Maggi, Victoria Dobrievsky, and the Equal Care Fund. Additionally, I have a super thank you to give to Jalan Rivera and Sanjeev Sharma for your support, guidance, and continued patience throughout this whole development process.
Thanks so much, Rebecca, for your presentation. And as I mentioned at the start, some of our students were not able to implement their project activities. And Rebecca was one example of that, and for reasons that she provided. So we are now going to open the floor for questions. Perhaps Michael, we can start with you, and then others, just raise your hand, and then Sanjeev will find a way for you to be unmuted and be able to ask questions to Rebecca. Go ahead, Michael.
Thanks, Rebecca. It's a really interesting project. I had a couple of questions I wanted to ask. Actually, let me focus on one. I mean, you mentioned in your presentation itself that COVID helped increase awareness around mental health issues. We've worked on a project here at Carsey over the past couple of years on looking at how to invest in social determinants of health. And we spoke to a number of actually hospital CEOs and heads of community health clinics, and many of them mentioned mental health issues as being both a problem and a social problem that was related to particularly lack of services available to low and moderate income people. They talked about, as you did, financial barriers and transportation barriers. And one of the issues that came up, and this is where I'd be interested in getting your thoughts personally, or what you may have heard in doing your project, the idea of telehealth. I mean, a lot of people are, talking about, well, transportation's a big issue. And people, if you talk to many therapists, as we talk to people, there's, as you know, really mixed feelings about providing mental health services through telehealth. I'm wondering if in doing the research for your project and even thinking about the implementation, how important is telehealth in terms of addressing the problem? And are there are the potential barriers or impediments? I mean, a lot of people thinking, if I don't have somebody, a lot of therapists say, if I don't have somebody sitting right in front of me, I can't really, I can't see their body movements. I can't really tell. But talk a little bit what you've learned in terms of the promise of telehealth, or maybe lack of promise.
Thank you for asking that question, Michael. I think that telehealth is definitely one step in a progress point in making sure that access can be available to more individuals. In my current role, I am an intake coordinator for a private therapy practice here in the Upper Valley. So a lot of my clientele have a choice of whether they are going to see their therapist in person or whether they are going to go through with a telehealth appointment. I think that a lot of the barriers that we do come across in accessing telehealth appointment is still not having secure internet access, having older populations who don't have the ability to go through, their cell phone to set up Zoom, to download, to sign in, to go through the passcode, to put in, all of this information and make sure that their technology is up to par. I think additionally, also, those technology pieces aren't always accessible to individuals. A lot of the patients that I connected with while I was at Dartmouth Health as a community health worker, they would typically have to come to the hospital to be able to even access those telehealth modalities, especially if they needed translation services to access those appointments. So I think that there's definitely a benefit, but I think that there's also that benefit of having in-person appointments with providers, and especially when there's a treatment or a mental illness that would be best suited to have those in-person connections, especially in relating to things like exposure response therapy.
Good, thank you.
Thanks, Michael, and thanks, Rebecca. Are there other folks who would like to ask a question Rebecca or make comments on the presentation? I think there's one person raises their hand. Let me just look at who the person is. I think it's Mahmoud. Go ahead, Mahmoud.
So this is also a very interesting capstone project that you did, and you were talking about access. And I was just wondering, what are your thoughts on local or state government participation in increasing access to healthcare in terms of affordability or reducing the cost? What were their roles and what have they done to improve it?
I think that right now I'm not necessarily sure what is being developed in regards to additional government funding for access to mental health care. I know that there is typically the push of trying to expand Medicaid to be able to cover things like this. But I do think that this is an area that needs a lot of legislative push in order to be able to even push against insurance on figuring out a reimbursement rate that's beneficial to not only the individuals that have the insurance plan, but also the providers that are giving the service. Because on top of providers asking for a high out-of-pocket rate, it's because of the fact that they are also trying to work to maintain their living as well. So I think that it's definitely a double-edged sword of there needs to be more participation from governments, from legislators, to be able to push to show that access to mental health care is important.
Thanks, Rachel. Thanks, Mahmoud. Sorry, thanks, Rebecca. I was saying Rachel because I'm seeing Rachel as a question, and I'll read it, Rebecca, and if you don't mind answering it live. Is the percentage of voter turnout low in the Upper Valley? There seems to be a high correlation between the government-funded services provided to communities and the grassroots political activities. What do you think, Rebecca?
I actually think that that's a great question that I should look more into. I actually don't know what our sort of voter trends happen to be in regard to our eagerness to actually go through with the voting process and making those changes. Definitely something to look into in regards to whether we do have a high voter turnout or whether it's not so much, and that's sort of where the legislature sort of falls and stalls.
Thanks, Rebecca. What do you call this? You thanked Sanjeev and I for our patience working with you and your classmates, but actually I'd like to return the favor and say thanks a lot for your patience, because it must be very frustrating for someone like you have fully developed a project. Not only the design, but also the basis for it. Not only that, the timeline, the SWOT analysis, the stakeholder analysis, the monitoring plan, the evaluation plan, your project assumptions, and all of those things that go with a comprehensive design and plan for a project. So, Sanjeev and I truly appreciate the patience that you had, or the ability to not be annoyed by still having our classes and having your classmates talk about your implementation in your case. You had to do something else, which is develop a grant proposal. So thanks so much for that. And let me just quickly see, there's one more hand raised, and we will allow the person to ask the question. And after that, we will have to move to our next presenter. So Bill, go ahead.
Okay, sorry, I had to be unmuted. Great work, Rebecca. I'm interested to know if you, in your process of doing your research, ran into grassroots organizations that are trying to deal with this from a client organizing perspective, or trying to get providers organized. It kind of is connected to the previous question about what level of voter participation and grassroots political action there is. So is there any kind of coalitions or any kind of groups that are working to build awareness on a advocacy and maybe even a legislative standpoint?
So the organization that I was able to work with, although still at the startup point, and definitely not at the funding point at this point, is started up by the owner of the therapy practice that I work for. It's called the Equal Care Fund. At this point, they are currently still trying to get donations and sort of pay off the balance that they currently have to be able to then bring in their project director and sort of go through with then getting additional donations. But that was sort of like the drawing point of, you have a fund and I'd love to be able to provide some assistance. Additionally, in the research of trying to look for additional organizations that are providing financial assistance, I actually came across a program that's through UNH Extension, Farm Strong New Hampshire, which is actually giving financial assistance for a specific amount of therapy visits for farmers and families of farmers in the state of New Hampshire. So another idea of another organization that's currently in the process of giving financial assistance for these sort of programs.
Thank you, Rebecca.
Thanks, Rebecca. Thanks, Bill. I'm sure everyone's appreciative of your presentation, Rebecca. We will have to move on, given that it's already 6:30. I should be a little bit better with the time management. But before we move on to our next presenter, I just would like to very quickly recognize the presence of some of our Carsey colleagues. Robin Hasledge, the program manager at Carsey, Dr. Melinda Negron Gonzalez, who's the program head of Global Conflict and Human Security Program, and also our alumni, and Bill Maddox, who teaches organizational management, among others, with the program. So with that said, I would like to share my screen now and have the presentation going for our next presenter, which is Miriam.
Haiti has been pretty much present in the world news in recent months amid calls for an international intervention to break the cycle of unending gang-related violence. My name is Miriam Narcisse, and my project focuses on the promotion of the participation and engagement of adolescent girls and young women in peace building and reduction of violence. According to the UN, the Office of Coordination for Humanitarian Affairs, it is estimated that for the first quarter of 2023, half the population of Haiti is in need, with the majority of them in acute food insecurity. And because of the gang violence, kidnapping has increased tremendously, 1 for every 6 hours. And there are a lot of people who are displaced, about 128,000. The project focuses on Cité Soleil, which is one of the largest shanty towns in the capital of Port-au-Prince. The project is implemented with the Haiti Adolescent Girls Network, which is a Haitian organization that I have been leading for the past 8 years, and it focuses on adolescent girls and youth between the ages of 15 and 20 years old in spaces that are provided by the community. The problem is that there is a lack of participation of underprivileged adolescent girls and young women in peace building efforts and violence reduction. And this leads to the fact that the reduction of violence in Cité Soleil is hindered. The causes of that is that there is a lack of education and employment opportunities, a lack of awareness spaces and inspiring models, a lack of physical and financial autonomy, lack of self-esteem and emotional resilience. Girls are lacking the knowledge about their rights, unsafe environment for women and girls, and there's a lack of male identity and positive masculinity. To better understand the problem, I conducted a research including focus group discussions with young people from Cité Soleil of both sexes, key informant interviews with subject matter experts, survey, document review, as well as observation. From the result of the research, to increase the participation and engagement of underprivileged adolescent girls and young women, there are a number of short-term outcomes that have been defined, including creation of employment opportunities, creation of campaign spaces and access to inspiring models, creation of income-generating opportunities for girls, access to trauma-informed tools and techniques, increased access to knowledge and treatment for addiction, increased knowledge on girls and women's rights, and increased knowledge on self-identity and positive masculinity. These are 7 out of 11 short-term outcomes that have been identified, and those outcomes are expected to increase the participation and engagement of adolescent girls, which ultimately will result in reducing the violence in Cité Soleil. To achieve the short-term outcomes, there are a number of activities that have been defined, which, with the input of resources such as staff time, meeting and training venues, funds for implementation, materials and equipment, are expected to produce a number of outputs, such as number of girls who have either completed training, have either gained knowledge, improved their skills on sexual and reproductive health and rights, have access to spaces, which will ultimately increase their participation and their engagement. So in order to achieve the short-term outcomes, I had to develop a timeline and a plan of detailed activities. What you see here is the detailed activities for one short-term outcome. And I had to do this for each of the 7 short-term outcomes I had selected for implementation. What are the results that have been achieved in the project to date? Creation of educational, civic, and employment opportunities as a short-term outcome. And in that short-term outcome, 207 participants between the ages of 13 and 20 years old, of both sexes, have been recruited and have been participating in weekly sessions. And 53% of them are females. Half the sessions completed cover life skills and prevention of violence and conflict. With regards to the short-term outcome, which is aiming for the creation of campaigns, spaces, and inspiring models, 15 community-based young leaders have been trained as mentors who have been working with the 207 participants in 11 community spaces that have been contributed by community members. In addition to that, I spent time and effort to write grants and reach out to donors in order to increase funding. And I'm very happy to say that I have been able to raise additional funding that are aiming to support the achievement of additional short-term outcomes. Of course, when you take the context in which this project was being implemented, we really had to face a lot of challenges, and the most challenging one was safety. And because of the gang warfare, some of the participants have, and their parents have suffered casualties. And in addition to that, there was restricted access to emergency care. Because of the recurring violence, at one point we had to discontinue the sessions. Fortunately, we had been able to resume them. But of course, another challenge that we had to deal with is the fact that because of the internal displacement of people, we had some issues related to the recruitment, both recruitment of participants and the recruitment of staff to implement the project. So in order to adapt to that situation, we had to strengthen communication. We had to leverage the engagement and the role of mobilizers and mentors present on the field. And we had to include also humanitarian aid for some of our participants on a case-by-case basis. And of course, least but not last, the use of technology that we had to leverage to ensure that we stayed in contact with the field, with the participant and the mentors, and to ensure that the program was continuing to be delivered and that we could address any issues that the girls were facing. From the design, the planning, and the implementation of the project, I learned that it is really very important to reinforce advanced planning so that we could take into account community members' availability, especially in certain periods of the year, like the Carnival or Easter. There's also be a need in the context that we've been implementing the project for us to have had a humanitarian response component as a way not just to promote attendance, but also to address pressing issues such as food insecurity and livelihoods. And of course, we had to remain very flexible and to learn to innovate in order to adapt to that constantly changing environment. And something that we didn't used to do before is in terms of monitoring, not only our participants were actively participating in the project in terms of absorbing the content, but they were also actively engaged in the monitoring itself. And finally, I really learned that it is so powerful to capitalize on local engagement. And this is something that really came from the result of the survey in terms of how do we engage, how do we increase girls' participation. And that's one thing that I really learned also, is that not only do we need to leverage the potential of youth in the community, but when we also make an effort to bring adolescent girls and young women at the table, they are ready and willing to engage to bring change in their community. In conclusion, I would like to share with you a quote from a short interview I had 2 weeks ago with one of the mentors. And he said to me, I chose to be an active leader and be a part of this project because I want others to have an opportunity to change and adopt a transformative behavior, just like it had helped me to do. And for someone like me who's been doing that work for some time, this is really very powerful because it is showing me that although the project has not been completed yet, but it is showing me that not only we are on the right track, but we are also having already an impact, a positive impact in terms of engaging them to take action to transform the community. Thank you very much for your attention.
Thank you very much, Miriam, for a very inspiring and comprehensive presentation of your project. You know, while we had our classes, I would be listening to the news about like things happening in Haiti. And it's great to have Miriam in class because she provides the on-ground update of what is happening by way of telling us whether or not her project is proceeding as planned, what delays are being experienced. So thanks for that, Miriam. So we're now opening the floor for folks to ask questions, starting with Michael and then for others. I will be a little bit more, I'll try to be better in managing the time only because we have 3 other more equally exciting presentations to come, but let's give Miriam an opportunity to answer questions, starting with the one from Michael. Go ahead, Michael.
Yeah, hi, Miriam. You know, one of the things that came across in your presentation is the incredible challenge you face in terms of balancing engagement with safety. And, you know, you talked about the training you provide and you know, it seems to me that simply providing the training itself would be a challenge to some people. I'm wondering if you could talk a little bit. I mean, you did say that the training involves life skills and prevention of conflict. I wonder if you could talk a little bit more about what it actually looks like, the kinds of things you do or say in the training, so we get a more granular sense really of what goes on in the training. How do you do this? What do you communicate and how do you try to do it? I'd be curious to know a little more about that.
Thank you for the question. Thank you for the question, Michael. Yes, the training is really takes the format of a participatory discussion. So the mentor, of course, is not a teacher, but is a young person from the community who usually has completed his or her high school, and they really receive the training. The training that they receive is a training to help them facilitate discussions. So those discussions really puts them at an equal level with the participants in the group. So the format is really the design so that there is an equal relationship in the discussion going on within the group. Of course, they are sex-specific group discussions, meaning that the girls only and boys only. to help them be very comfortable, confident, and have the intimacy and the safety they need to share about very personal issues. That's one thing. The second thing is that I mentioned life skill and prevention of conflict. So what we did, we have developed, we have a whole set of sessions on several topics, because our experience has shown that when you're talking about empowering adolescent girls and young women, you really need to look at the determinants of certain situations that they are facing, like sexual and reproductive health, prevention of violence, or financial literacy. So basically, there are a number of sessions with specific topics around those themes: financial literacy, sexual and reproductive health, violence, health prevention, and also for this particular group, we have introduced the prevention of violence and conflict. So basically, one of the organizations that we've been working with is one of the organizations that's been very prominent working toward reduction of violence in Haiti. So that's one new theme that we introduce in our curriculum. So basically, the mentor has a curriculum with the session that's structured about what she needs to do for each activities. And there is a discussion that goes on around those topics that are addressed during the group. And as I am talking now, basically next week, the implementation is going on. So basically the mentors together, they're coming together and they are planning what we call community dialogues, meaning that they are going to bring together several different key stakeholders in the communities, including the parents, the leaders, the gang leaders, and other young people, so they can start addressing key issues that they have identified, questions they want to address within the groups, so they can together start thinking about what kind of actions they want to bring together. Because the idea for us is really, how do we bring young people at the table? How do we increase their participation in governance and decision-making? Because I really believe that this is what's going to create change within their community.
Thank you.
Thanks, Michael. We have a question from Melinda. Okay, so Melinda's question is, great work, everyone. Miriam, you mentioned that you successfully raised funds. Can you talk more about how you were able to do this?
Yes, yeah, it's really very, very challenging. I think that I have to say that I'm very fortunate to have been doing community development work for some time now. So raising funds is really a big issue, especially now that even in light of what's going on in Haiti, Haiti is not so much the focus anymore. You see a trend in terms of increasing an increased focus on Africa versus Haiti. So basically what I've been doing is really doing research, especially with regards to the UN, because the UN has several agencies that are really looking at how they can support the work in Haiti. And the challenging thing is really to find the angle. So what I did was really to continue building the case, continue developing grant, but really in putting the focus on young people-led initiative and activities, meaning that not only for young people, but with young people. So having the right language has really proven very effective so far. And it continues. I mean, I can't say that I have all the funds that I need to really implement all the short-term outcomes, because I did mention I had 11 short-term outcomes and I had 2 intermediate outcomes, but it is really ongoing work. Really, we're looking at how I can leverage the donors that I've been working with. And also a very important part also is sharing the results of our work. For instance, for doing the survey, I tried, what I did was partnering with the UNICEF, so that we can actually reach out to community-based organizations in the country. And I had over 500 respondents. So that's also the type of work that doesn't necessarily require money, but that agencies that have funding are very much interested in, because it really helps them understand the reality of what's going on. So that really gives a partner, strategic partnership, so that that information, that data that I'm providing can help them build their case and raise their own funding, and at the same time can help me build the case for the work that I'm doing on the ground.
Thanks, Miriam. Folks, a little time management here. I know there are 3 more folks who would like to ask questions. I can only give into one, only because, again, Bianfit, etc., would like to also do the presentations. I'm giving the floor to Gerda, and she wrote her comment saying, "Hi, Miriam, great work. My question is, how are the gang members engaged in the community discussion?" And by the way, Rachel and Mahmoud, you'll have the opportunity to actually ask these questions that you have, hopefully towards the end of the presentation if we have time. Sorry about that, but we have to prioritize time management. Go ahead, Miriam, to the question.
Well, thank you for the opportunity to share about my journey with this Capstone project. One of the things that that we did, I mean, even doing the design, I did mention that we did have key informant interviews with subject matters, and one of them was the former gang leaders. So we could actually, I could learn exactly what were the specific factors that needed to be taken into consideration in doing a project like this, and also focus groups. So basically, even from the design stage, we have been having a conversation with the gang leaders, not just the gang leader. I did mention that spaces contributed by the community, which means that we have been doing what we call consultations with the communities, meaning to bring the program to them, to explain what the program is about, to meeting with the gang leaders, so we could have their approval. And there's no way we could have done that project without their approval. So one thing also that was very important was really to maintain transparent communication. So the community mobilizers are really the face of the project on the ground. They are not only supporting the mentors, but they also ensuring that they are meeting with the gang leaders to share what's going on and keep them informed of the various stages. For instance, the recruitment process, for instance, the community dialogue. So this is how we've been implementing the project, really keeping transparent communication with them. For instance, I mentioned casualties. We had an issue where a relative of our mentors have been murdered by a gang member, which was really a very shocking event. So basically, with the community mobilizers, he was really the go-to person who actually met with them, and so he could understand what was going on. So the gang leaders could actually share what happened. And unfortunately, I cannot share what happened here because they insisted that it remain confidential. But this is really, again, the type of conversation that you have to constantly maintain with them, so that you can actually address every issue that arises in the course of the implementation of the project. And also to allow the young people in the community to be able to actually engage and contribute.
Thanks a lot, Miriam. Folks, I'm warning you already. We will most likely go beyond the time, and this is sort of like a common theme in our classes. It's always like me requesting for extra time because, as you could see, the discussions are very interesting. We meet every week from 5:30 to 7:30 every Wednesday, and this is not an exception. This is one of our classes, and we will most likely extend again. So I would like to already apologize ahead of time. But Miriam tried to implement a project in a community that is facing a lot of insecurity. So our next presenter, Bianfit, also tried to implement a project in a community that is facing a lot of violence and human insecurity. So we will hear his story, how he developed his project, and whether or not he was able to implement his project. So I'll share his presentation now.
My name is Bianfit Polepole, Masters in Community Development. My project is about supporting struggling education in a village where unemployment is on the rise. My project is based in the Democratic Republic of Congo, DRC, is this big country that you can see in the mirror of this map, of this African map. DRC is the second largest country in Africa with the second largest rainforest in the world. They have several languages, among them Swahili and French is the official language in DRC. My project is located in a small village located in eastern part of Democratic Republic of Congo, and that village named Muniki. So, how you can see on these slides from the West Bank, the trends of this slide show us that the youth unemployment rates for the Democratic Republic of Congo were low in 2005, and from there it has been rising till 2020, where we can observe the highest level of unemployment rates of youth in Democratic Republic of Congo. And if you can see, is almost 10 million of youth who are unemployment in DRC. So this to show you like that unemployment still be a big issue in Democratic Republic of Congo. In order to understand better this project, the problem analysis, my research showed that there were several problems. As we can see, the problems we have in this village is the low enrollment score, the high percentage of youth joining gang movements and armed groups, parents who can support schooling of their kids, low number of companies in the village, and youth who are trying to quit the village to the town, seeking for job opportunities. And these problems are leading automatically to these effects, which are low school completion rates and high youth unemployability rates in the village. So besides this, we have several causes like lack of classrooms, lack of physical and financial security, unfair hiring process, companies who are leaving village and there is no job opportunities. So we used some tools to obtain those results. Among them, key informant reviews, focus group discussions, literature review, and survey. This is just a sample of the two books of the books I read. I read a lot of books, but this is just a sample, and it's just two books. Those I read during my documentation review. Once we did that, we were able to come up with some intermediate outcomes. As you can see, our intermediate outcomes was to increase school enrollments, decrease percentage of youth enrolling in gang movements and armed group, increase the ability of parents to be able to take charge of their kids schooling, increase the number of companies in the village, and decrease the number of youth who are quitting the town, no, the village to the town. This Intermediate outcomes are linked to these long-term outcomes, which are to increase completion rates in the village and to lower youth unemployability rates in the village. Besides of this, we had some short-term outcomes like increasing the number of classrooms in the village, increasing physical and financial security in the village, increasing parent skills, increasing fair hiring process, list companies who are quit the village and create more job opportunities in the village. So these short-term outcomes are linked to these intermediate outcomes. Intermediate term outcomes, yeah. So we had 6 short-term outcomes, and this is just a sample of one of them, which was construction of classroom. And here we are showing you what was the activities we did, like meet school officials and so on. And all our 6 short-term outcomes, you can have it in this timeline, but here we show you only 2 of those 6 short-term outcomes. However, and unfortunately, if I can say that, I was not able to implement the project for some reason. First, coordinating projects from New Hampshire. So I'm living in New Hampshire in USA, but my project is located in DRC, in a small village far from here. So there was a problem of communication and timing. Again, Goma town and Munigi village are war zones. So we had difficult sometimes to send our friends who was helping us to drive the project from the ground. We were sometimes in difficult to send them to help us drive the project because of war. So that was a problem either. Again, fortunately, we was able to do the SWOT and the stakeholders analysis. This SWOT allows us to know the strength and the weakness of the project. We learned positive factors and negative factors with SWOT analysis. We learned a lot when driving this project. First, we knew that community development is about participation. So the project is not our project. The project is for the community. So we have to include all the members of the society, all the members of the community, ask them to bring their brick to the building. Again, we need to be patient and flexible when we are driving a project. Patient because of time, for example, and flexible because of time again. Don't wait. If you have an opportunity to do something, do it, run. Also, SWOT analysis. I like this tool. Why I like this tool? Because SWOT is giving you the idea of your project. So you know the strength of the project. You know the weakness of the project. You know the opportunities that this project are giving you, and you know the threats that the project is going through. So for my case, if I knew before what was my source, maybe I should be able today to implement my project. I should be able to know what was the weakness and the threat of the project, and maybe this would help me to overcome the situation. But unfortunately, SWOT was just in the middle of the project. But next time for me, I learned that I have to start by SWOT analysis. Again, we have to be open to different ideas. Make sure voices of everybody are well received. I can't finish this project without thanks my God and bow my knee down for all he did for me. My family, my wife, my kids, my classmates, and my professors. Thank you, because I remember the first day when I met with Mr. Sanjeev, my professor, at Dover Public Library. He was explaining to me he was giving to me the overview of the program. So I was fascinated. And I knew that was a thing that I was looking for, because this was my dream from when I was young. But I was asking myself a question. I will be able to do this. But now, when it comes for designing, when it comes for implementing, when it comes for monitoring or evaluating the project, I can say now I'm good. Because I can't say that I'm perfect, but I can say I'm good. And my dream to become a community builder is becoming true. Thank you so much.
Thanks so much, Bienfit, for a very passionate presentation of your project. A little bit of context there. So people must be asking, why did we allow Bienfit to implement a project when he's here and his project is in DRC? It is not uncommon, folks. We've had students in the past, especially folks from countries in Africa, who are able to do so. Morocco, some countries in East Africa. And number two, as you've heard, Bienfit, when he was still learning about the program, was already very passionate about this project. So Sanjeev and I took the risk and say, so long as you can show, your resolve as well as the availability of support. He has colleagues in Munigi that were able to help him. He was able to do FGDs, KI surveys, by working with his colleagues. Unfortunately, because of the insecurity and instability happening in unpredictability of the situation in Goma, it was difficult for him to implement now. However, Sanjeev and I are confident that Bienfit will be able to implement this project as properly designed, fully designed in the near future. So we're opening the questions now for folks, starting with Michael. Go ahead, Michael.
Yeah, hi, Bienfait. Good to see you. The problem you described is sort of a classic one when you look at rural development. You cited all the impediments, low education, parents can't afford schooling, the youth join gangs, there's no employment in the village, and yet you propose, we need to get more education. One of the questions that often comes up is, would education necessarily increase employment if there's no economic base to begin with? So when you look at the community you're working with, and I'll even recognize, if he's still on the call, Bill Maddox, who for many years organized trainings in microenterprise. Microenterprise was often presented as a first step towards looking at employment opportunities by trying to create self-employment opportunities for some people by looking at opportunities in the informal economy. That the idea that you could attract companies to a rural area in the DNC, just didn't seem realistic. When you look at that starting point, how do you see education as tying in, and what is a first step? I mean, because it seems in many ways like an intractable problem. It doesn't seem like there is a competitive advantage for these villages to really attract businesses or build businesses that would really be well-paid employment for youth.
You can unmute yourself.
Yeah, thank you, Michael.
You can turn your video on too if you want.
Yeah, I say thank you, Michael. It's nice to meet you again. It has been a long time. So I was thinking that there is a correlation between education and employment. The more you are educated, the more you can have a good salary. So in Goma town or in the village of Monigi, it's sure that there is no many job opportunities, but opportunities which are there, young youth can't have those opportunities because of a lot of youth in the village are not going to school. So it's difficult to them to have a good job. So that's why the project proposed to bring back youth to school with hope that this can help them tomorrow to have a good job opportunities. And it's sure because like now in the village of Monigi, only 2.1% of youth can attend university level. Or to have a good job in Goma today or in Monigi today, you must have a minimum of bachelor degree. So you can understand that is without education, those young will be difficult to find a good job.
So what I hear you saying is there actually are some job opportunities if you have certain basic educational skills.
Please, can you come again?
Yeah, what I was getting at earlier is just, and I don't want to take a lot of time with this, but it's questioning the idea of the correlation between education and jobs, because if there are no jobs, it doesn't matter how much education you have. But what you're saying is there actually are jobs if you have the education, that the youth there simply aren't able to access the jobs that exist.
Yeah, there is job in Goma, but to have those jobs, you must first have a good level of education.
Okay.
And also beyond feet, maybe, because I remember your project, one of the things that came out of your key informant interviews in FGDs is that nepotism, isn't it? The idea that there are jobs, but who gets the jobs, isn't it? It is who you know rather than what you know. Remember that one of your short-term outcomes is to actually have policy. I don't want to talk on your behalf, but if we look at your document, part of your short-term outcomes and your outputs is to actually approach the government and the Chamber of Commerce and see whether or not there's a way to comprehensively look at hiring practices as part of your outputs. But as Michael is saying, but hopefully, as you even said in your recommendations, to keep an open mind to other ideas, that perhaps it's not only formal employment, but perhaps even informal employment by employing yourself. And this is where micro enterprise and microfinance could be an option. So we suggest that to keep an open mind and hopefully in your final report to be able to reflect this as one of the things that you've learned from the project, okay?
Yeah, it's okay.
And that should also partially answer Melinda's question, but I'll just read the question. Great work. How do you think local stakeholders, especially government and school officials, would have received your project? Would they have been open and collaborative?
Yeah, please, can you come again? Was just something like a...
So how do you how do you think the local stakeholders, especially government and school officials, would have received your project? Would they have been open and collaborative?
Stakeholders?
Yeah, like
Government, school.
Oh my God. I'm not getting it.
Do you think, remember when you developed this project, Beyond Feet, you spoke with government officials. I know that because you submitted.
Yes, yes.
You spoke with school officials. were they open to the suggestions you were giving them with regard to? Okay, go ahead.
Yeah, I can understand that. Okay, so that's why I said the one of the problem we had when driving this project sometimes was a conflict between government and my friends who were in the grounds driving the project, because sometimes when you are asking questions to government members, they are thinking that you are accusing them because the project is putting them in front of their responsibility. When you are talking about low level of education, they are thinking that you want to say that they are not responsible and they are not giving to kids the education that they deserve. So that was kind of the conflict. That's why we choose government officials, local officials as participants to the project, because the idea was to go with them during the project, and then they can submit their vision of the project. And now we make sure that there is no conflict between the project and between the national education system, because they have their national education system too. So we choose officials, local officials, like project participants, to make sure that they are with us from the beginning of the project to avoid any kind of conflict in future.
Yep. In fact, that was what I thought was what happened to your project. Your submissions of the results of your focus group discussions or key informant interviews and your SWOT and stakeholder analysis involved school officials, involved local government officials, and it is their suggestions that ended up informing the design of your project. So when you said that, you know, it's important to engage the community, you did indeed engage the community. So given the limited amount of time in the presentation, you were not able to dig deep into it, but I can assure you folks that in BNFIT's final report, it actually shows that the engagement of local government officials and school officials were crucial in the design of the project itself. So thanks, BNFIT, and thanks folks for the questions that you have for BNFIT. Again, it's 16 minutes to the end of the class, but we will extend a little bit because we need some time to also address something on education, but it is more in the US at a smaller scale and a more personal level. Nazim is going to have his presentation on transitioning elementary school kids to high school as his capstone project. And then last but not least, we will have Chase to talk about more at the organizational level, addressing the issue of.
Hi, my name is Nazim Mordari. I'm doing a transition from 8th grade to high school. My project is located in Atlantic City, New Jersey. Atlantic City is most known for casinos, gambling, and concerts at Boardwalk Hall. If you look along the right side of the map, you'll see stars. The stars indicate where the casinos are located. If you look along the same line, you'll see Boardwalk Hall, and Boardwalk Hall is where they host concerts, professional football games, and even college basketball tournaments. Most people don't know that there's two parts to Atlantic City. You have the tourist part, which I just showed you. And if you look inland, where you see the streets, that is the living part of Atlantic City. Atlantic City is only 48 blocks long. However, it has many bad neighborhoods and gangs in Atlantic City. If you look at the bottom street, there's one more street below that. And if you count the streets all the way up to New Hampshire Avenue, you'll have 48 blocks. So Atlantic City is really small. The average annual household income in Atlantic City is only $29,800. So there's a lot of poverty in Atlantic City, causing many gang violence. Crime rate, Atlantic City has a crime rate of 31 people per 1,000 residents. So Atlantic City's crime rate is really high and above average. My original project was to help high school seniors get to college and also help them with help the seniors with the transition from high school to college. Looking at the problems within this project, I know there's a lot of kids that have the grades or scores to be accepted into college. The cause of this was stemmed from freshman year of high school. So I was thinking maybe I should take a step back and work on the initial problem. I thought maybe I should start with a smaller project, start with the 8th graders transition into high school, because kids can only go to college if they are qualified. And it's better to be qualified and not want to go to college than to not be qualified and want to go to college. During my new project, I did 3 informant interviews, and I also did a survey. This to help me with some problems and learning problems within this project. So I interviewed Samantha Sickler, who was vice principal at Atlantic City High School. I interviewed an anonymous Atlantic City High School guidance counselor, and I also interviewed an anonymous Atlantic City High School graduate. So Samantha Sickler worked in the Atlantic City School District since 2013 to 2014. Samantha believed the highest among discipline issues stemmed from the 9th graders. She also thought it would really help if the 8th grade teachers modeled the high school credit system, because in the 8th grade, they have a system called No Child Left Behind, and that means a child can miss a great amount of days of school and still be able to make it to the next level or still be promoted to the next level. When at the high school, if you miss a certain amount of days, you have to make up those days during the summer, or you have to repeat that same grade level the following year. The anonymous Atlantic City High School guidance counselor was a guidance counselor for 10 years, and then in their 11th year this year, they stated that the freshman class is the lowest GPA out of all classes, which is a 2.08667. The anonymous guidance counselor also believed the most important thing that the 8th graders have to realize is that they have to be present in school and classes. And I feel like this is another piggyback off of Samantha Sickler's thought of having the same credit system as the high school with the middle school. Because again, if the kids are not present in the school and classes, then they have to make up the days, or they will have to repeat that same grade level. The last informant interview I did was anonymous Atlantic City High School graduate. The anonymous Atlantic City High School graduate said that they was nervous going from middle school to high school. They also said that the GPA was as low as freshman year. The hardest transition was time managing. They also did not prepare for high school. These are problems that I came up with a little research myself. So there's nobody watching you at all times in a middle school. So going from middle school where there's people watching you all the time to going to high school where there's nobody watching you and you just have a certain amount of time to make it from one class to the other class. If you don't, teachers are not going to look for you. If you decide to skip class, teachers are not going to look for you. Within the middle school, it's a little different. People are looking for you and teachers are looking to see where you're at and why you are not in that class. GPA is low freshman year, which, as you see, the Atlantic City High School alumni, Atlantic City High School graduate stated in their interview. Going from 8th grade to high school, many people are still trying to find themselves. They're transitioning from a young teenager to a young adult, and in high school, this is the time where people are trying to find out who they actually are, and they can be influenced by a lot of bad things going into the high school. So introduced to many bad influences can affect them freshman year. Lastly, they don't know how to time manage. Again, you saw that with the interview of the Atlantic City High School graduate, where they had a hard time management coming from 8th grade to high school. I also did a survey. I interviewed 82 anonymous people who are Langston High School alumni. 71 out of 82 people did nothing to prepare themselves for high school. 61 out of 82 people encountered some type of problem freshman year. 61 out of 82 people said they only had class with 0 to 10 classmates from their middle school class. And then 72 out of 82 people said that they had a program in the 8th grade to go down to the high school for a day, they would have joined the program. There's a little more from my survey. 53 out of 71 people that did not prepare for high school had some sort of problem freshman year. If you look at this diagram from my survey, from this diagram, I got that 53 out of 71 people that did not, from this diagram, I got that 55 out of 72 people who had any sort of problem will have attended a program in middle school that allowed them to go down to the high school for a day. So many people that encountered the problem thought that if they went to the high school for a day in 8th grade, many of the problems could have been avoided, or they could have been a little more comfortable when they was transitioning from 8th grade to high school. After getting to know many of the problems in this project, I went and came up with long-term, intermediate, and short-term outcomes that help complete my project. My long-term outcome is to help the 8th grade kids in the middle school in Atlantic City have a nice and smooth transition when they are moving up to high school. Intermediate goal is to start allowing the 8th grade students to take a day off school and attend Atlantic City High School for a day. Now I have 3 short-term outcomes. My first short-term outcome is to start a program that allows the 8th grade kids to attend Atlantic City High School for a day. My second short-term outcome to implement adequate disciplinary measures for the middle schools in Atlantic City. My third short-term outcome is to have 8th grade participate in a new number of time management workshops that are built in their classes. Now, my first short-term outcome was a really good success. I completed that outcome earlier this year. The kids were able to go down to the high school. They're able to meet other kids in 8th grade schools in Atlantic City at the high school, so that they are familiar with some faces outside of their own middle school class. He was also able to meet teachers, learn how to read their schedules at Atlantic City High School, learn how to get to their class at Atlantic City High School, and just get a little bit more familiar for when they go to the high school. My second short-term outcome was implement adequate disciplinary measures for the middle school in Atlantic City. However, this short-term outcome was not a success. The Board of Education denied this short-term outcome. For one, it was late in the school year, so it was not a good time to implement disciplinary measures, because that's something you cannot just implement within the next week. That's something that has to be implemented over the summertime, where they have time to discuss it, inform the kids' parents, and then they can implement it during the start of the school year. During this time, it's also park tested and state testing, so it's also not really a regular school day, so it's hard to implement new disciplinary measures for these kids, and then some kids get in trouble and it would affect them with testing. So that was denied by the Board of Education. However, I am going to work towards it during the summertime and try to implement it for next school year. My third short-term outcome was have 8th graders participate in a number of time management workshops that are built into the classes. Right now, I just started this short-term outcome. So far, it is a success. Again, I just started it, so I'm still discussing it over with some teachers and principal, taking this to Board of Education to get it approved, and then we can go from there. What I learned from this experience, this project takes a community village to be successful. When I first started this project, I thought maybe I could do it, and I have help from 2 other people, and it will be completed. However, I didn't notice that there's other people that may be involved with this project who can affect this project that's not directly involved. So it does take a village to complete the project. For instance, just the students' parents. Again, we had to get permission from the students' parents to allow them to go down to the high school and take this trip to get this experience. And if no students' parents allowed them to go down to the high school to experience the trip, then it would have been a fail, and that could have ruined the project. So it takes a community and a village to complete a project successfully. It's always good to have a backup plan for everything, just in case things go wrong. Again, this is life, and in life things go wrong. Emergencies happen. Again, pandemics happen. COVID just happened 3 years ago where there was a pandemic. So you just have to be prepared and be ready for anything that comes your way. Also, that it is easy to do a project when you know the community and who you're working with. When you get familiar with the community and you get to actually know how the community feel in that problem within a community, then it's easier to work with them. When you can relate to them, it's easier to work with them. So just getting to know your community and getting to know the problem within the community and actually relating to the problem can really help you with your project. These are my participants for my project. I want to give a big shout out to Jason Lance. He was really a big help in my project. Also, Samantha Sickler was a really big help in my project. So I do want to get a shout out to them. If anybody have any questions, feel free to ask. Thank you all.
Thanks so much for your presentation, Nazim. We have to bear in mind that Nazim, while doing his project, was actually part of the varsity team of UNH. So having to travel, having to actually practice, and still have to be bugged by Sanjeev and I about his KIIs, FGDs, surveys, etc. It was really a huge commitment for Nazim to be able to complete his project, again, with his own resources and not having to rely on any organization to be able to do it. So questions for Nazim is now open. Let's start with Michael, and then I think Mahmoud. Go ahead, please, Michael.
Yeah, hi Nazim, nice to see you. So I don't know, I have a question as much as an observation from listening to you, which is first that sort of pinpointing 8th grade as a tipping point for a lot of kids. Hadn't really thought about that so much. I thought you made a pretty convincing case for it, and I think Jolan's last point as well. Maybe there's a question there, which I was thinking the same thing, which is, you know, with very few resources and no sort of institutional backing or support that you're part of, it's a hard project. I sense I came away with was that if you had that sort of support, there'd be a lot of ideas that you'd have to do it. You know, I mean, starting with a trip, but really going to how do you provide more support, you know, even in smaller cohorts to people who are going to kids who are really going from this, as you said, transition from, you know, to young adulthood and at that point in time. So yeah, I guess my observation is interesting. I hadn't thought of that as so much of a tipping point, but when you describe it, it's like, yeah, that makes sense, because now you want to try and figure out, well, how can I belong? What are my options? And how can the school better facilitate that? So I'd be interested in seeing what you would do if you really got free hand, if they hired you as the, you know, transition coordinator for the high school. My sense is you'd have a lot of ideas that you could come up with that would really facilitate that transition.
Yes. Actually, down at the high school, there's many things as far as sports. We have a ton of sports at the high school. We also have a ton of after school activities. We have a ton of clubs at the high school. I feel like once we introduce those also to the 8th graders, and they start joining clubs or activities, and they get to, meet other people. So like my transition was a little bit better because I was on a football team. So coming from 8th grade, I had, teammates. Not only did I have like the 8th graders from my middle school, but I had teammates who were on the team who was in a high school where I see in the hallway or I had see in lunch. And it makes you a little bit more comfortable. Again, going down to the high school, the kids had a really good time. I feel like that really helped them with making that next step to the high school as far as being comfortable, getting to meet new people, seeing new faces, just getting familiar with the guidance counselors down at the high school, a few teachers down at the high school. I feel like the more we connect, the high school connects with the middle school, I feel like you get a better relationship and just help the transition go a little bit more smoother.
Thanks, Nazim. Mahmoud, there's a question. Go ahead, please, Mahmoud.
Hello, Nazim. This is Mahmoud. As you were doing your presentation, because this is my area, I'm an admissions counsel at the University of New Hampshire. And I definitely agree on the points that you were making. I was jotting down questions and you're addressing them as we went along. You're talking about time management, you're talking about getting involved. My question is, have you tried to engage any college or universities to start having conversation with these students? Because that's what we essentially do. My territory is in New York and Westchester and Long Island, but we also have admissions counselors in New Jersey trying to engage students as early as the 8th grade. And you're right, the earlier we address the issues or let the students know what it takes to get into university, the more motivated they are if we can draw a plan for them through every step of the way. So my question is, since you're right on campus, I think it will be interesting for us to have a conversation, also get the director of diversity outreach inclusion, and to see how we can work in partnership to engage these students at a very early age, especially in the 8th grade, but not just in the 8th grade and 9th grade, but it's a continuation process, even possibility of just having this conversation, getting them involved, letting them know what it takes, what we're looking for admissions counselors. Have you done anything to reach out to colleges or universities, or is that something you're interested in doing?
I have not done that yet, and we actually don't do that in Atlantic City. So I mean, that's definitely something moving forward that we could try to implement and work on. I think that would be definitely a great idea, because though a lot of 8th graders don't really know exactly what they want to do, and then even when they do know what they want to do, they don't really know exactly the steps to get to where they want to be at, especially being that young. So I think that's an excellent idea, and I think that is something moving forward with the project. I think that is something I should definitely work towards.
And just to follow up on that, you can reach us out at the admissions office, undergraduate admissions. You can find my contact information on our website. And if you want to continue this discussion, we can take the next step further. As far as going to the schools, we can do that. We can go out to the schools if there's a select target of schools or a particular location you want us to meet and engage the students, we can do that. But if you're interested in that, you can find my contact information on the website or contact Sanjeev or Jolan. I was part of the community development program. You can reach out to me and we can take it from there.
Okay, I appreciate that. Thank you so much.
Thanks, Mahmoud. Thanks, Nazim. And indeed, Mahmoud was a student of the program, so he's very familiar with the process that you've gone through. Thanks, Mahmoud, and thanks, Nazim. And now to our last.
Well, actually, Melinda has a question, Jolan.
Oh, sorry about it. Go ahead, please.
Do you have time?
Yeah, we'll go ahead.
Okay. I'll just read it. So, great ideas. What kind of disciplinary measures did you recommend to the school? I wonder if a mentorship program that connects high schoolers and middle schoolers would be another way to ensure a smooth transition.
So I wanted to implement, again, I wanted to take away the no kid left behind rule that they do have in the middle school. Some kids miss, 30, 40 days of school out the school year when they're only in school for about 160 days, which is unfair. And they get to the high school and they're missing days because they're so used to this bad habits. And again, they're left behind at the high school and they fall behind. So I wanted to implement that. Also at the middle school, they pretty much make you walk to your next class with like your teacher or your teacher watches you, I feel like they shouldn't be watching you as much. I feel like it should give you a little bit more freedom, whereas though they allow you to get from one class to the next by yourself. So I took that to the board, and they just thought it was too late of a year, too late in the year to implement those things. They did talk about as far as trying to implement those things going into next year. So I'm still just in contact with them, going back and forth, just to work on it during the summertime. So.
Thanks so much, Nazim, and thanks for the question, Melinda. And it's good to, I'd like to point out that Nazim walks the talk, okay? So Nazim, again, as we said, is part of the, he's a student athlete, so every now and then he could not attend our classes, but it doesn't mean that Nazim is just, okay, scot-free, well, I have a good reason to not attend. He makes a point to actually meet with us. For every class that he misses, the next day, he meets with Sanjeev and I. And then he listens to the recording of the previous class. So I think what you're saying is consistent in the sense that, attendance might be just merely showing up, but not really. Attendance matters, and it should something that is part of the disciplinary measures going forward. So thanks for saying that, Nazim, and for the consistency between what you say and what you actually do. And is that okay, Sanjeev? We're okay with the questions?
Yes,
Okay.
yes, we can move on.
Thanks so much. So last but not least, I would like to play the recording of the presentation that was prepared by Chase.
Hello, my name is Chase Siegelson. This is my final presentation for the Master's in Community Development Policy and Practice program. So public transportation in Hampton, New Hampshire. This project aimed to implement a public transportation network throughout the town of Hampton, New Hampshire. This would have been aimed mostly at those who had transportation issues, such as the impoverished, the elderly, and those with disabilities. I want to do this because I know that Hampton has a slightly higher percent population of elderly individuals and a higher average age than the rest of the state and the rest of the country. So I felt like this is something that would be in need. Unfortunately, this didn't work out. And this didn't happen for a number of reasons. First of all, there's a lack of perceived support from involved parties, including the Hampton Public Works and the Hampton Town Selectmen. Additionally, a similar project was attempted once before and didn't get out of the conceptual phase. And this is mostly because they found out that it would cost the town around $20 million, and they didn't feel like this was a good source of funding to use. And additionally, Hampton Selectmen didn't believe that there'd be a real need for public transportation in the town, and that it would go unused, and it would be, again, a waste of that funding that was used. So what did I do? For the next few weeks, I sent around 15 messages to a variety of organizations, groups, and companies containing information on myself, my background, the MAC DPP program, and my contact information. And I just asked if they had any community development-based projects that they would like a master's student to help out on. And for a while, I really didn't hear anything back. The only message I actually got was from one of my professors, but that project also didn't go anywhere. That was until the town of Derry contacted me. And that's the project I ended up doing. So the town of Derry was in the need of an independent facilitator to help with a multi-generational feasibility study for a potential multi-generational community center that would have been constructed in the town of Derry that would have been able to be accessed by the entirety of the greater Derry area. So what is the greater Derry area? That consists of the towns of Derry, Londonderry, Chester, Wyndham, Sandown, and Hampstead, which you can see on the map on the right is that little area highlighted in red. Parts of these towns actually used to be part of the colonial township of Nutfield, New Hampshire. And by parts, I mean the towns of Derry, Londonderry, and Wyndham, the entirety of those towns, and parts of the other towns. Since the towns split, the origin has still been celebrated. Actually, in 2019, the town of Wyndham held a 300th year anniversary of Nutfield's establishment to talk about this. So here are some of participants in the project that were directly involved. We had representatives from public organizations like the Town of Derry, representatives from private organizations like Community Caregivers of Greater Derry, the Alexander Eastman Foundation, and representatives from schools nearby, such as Next Charter School and Puritan Academy. And on the left there, you can see a picture from one of our meetings of myself and some of the group members. So here are the issues at hand. So since the split of Nutfield, these towns have seen different levels of growth, especially economically, leading to some having much higher and some having much lower economic well-being measures than others. And on the right, you can see a median household income by census year differentiation, where you can see that Windham has grown exponentially to the point where their median household income is above $150,000 per year, where a town like Derry has a median household income smaller than the rest of the state, at about 69,000 per year. And it varies greatly between all of these towns, even though that they all started from the same area. And due to this, citizens have not been able to get access to resources and services they need at social service organizations. And those organizations have also been a bit non-communicative and non-collaborative with the towns and fellow organizations. And several organizations in the summer of 2021 contacted the town of Derry with issues regarding space and resources available, as they felt like they weren't able to service the residents as well as they would like to as well. So to identify these problems, a number of activities were taking place. First of all, a document review was done by myself, the independent facilitator, regarding previous meetings before I was added into the group. Additionally, focus group discussions with directly involved groups were also done. There was one done pre-implementation of the surveys I'll talk about next, and also one done post-implementation to see if the communication and collaboration between the involved groups increased at all. Additionally, key informant interviews with lead members of the multi-generation feasibility group were done to better understand the causes of the issues that came up. These lead members were Beverly Donovan of the Town of Derry, Sarah Garvin of the Marion Garish Community Center, and Michael Fowler of the Derry Public Works Department. Additionally, 2 different surveys were developed by myself, the independent facilitator, and finalized by the multi-generational group. The first survey was aimed at Derry residents only and got 540 responses. And the second one was for residents of the entire greater Derry area and got 373 responses. These surveys aim to create a better understanding of the wants and needs of residents of the greater Derry area when it comes to multi-generational center, and the knowledge they had of the social service organizations in the area and their use of it. Unfortunately, we weren't able to do simple random samples, so the responses that were received were can only be attributed to those who are most likely to have seen where the Qualtrics surveys were posted, which was on the organization's websites, and they're also sent to users of the organizations. So overall, there are a few project outcomes that we were aiming for. So long term, we wanted the need for a new location space to be met, leading to residents being able to access and utilize all the services and resources they need. That was the overall goal. And we knew this would take around 6 to 7 years to complete, with construction of the location and implementation of the organizations in that location. So before that, we wanted to improve the collaboration communication among a number of organizations in the greater Derry area who also need of the space and locations, which would be addressed by the new multi-generational center, and the town of Derry, who needs the new multi-generation community center, leading to the needs of residents being met. To do this, 4 short-term outcomes were developed. These were that an independent facilitator was available, myself, and there was improved shared needs between the organizations involved. There was improved knowledge of community needs when it comes to resources and services they would desire, and other sorts of things that we offer at a multi-generational center. And that a report was developed to show group findings. This report would then be presented by the Dairy Town Selectmen during the budgeting process in August of this year. So what if we did nothing? What if we didn't do any of this? What if we decided to let all these organizations do what they were going to do, run out of space, and not be able to work together? So the potential effect was that the need for the new location, the space were unmet, and that residents would be unable to access and utilize all the service and resources they need as easily as they should be able to. And this was would be due to a lack of collaboration among the organizations and the town of Derry, and they wouldn't be able to meet the needs of residents. And some causes of that would be that there would be no independent facilitator because there'd be inadequate knowledge of shared needs between the group members. There's inadequate knowledge of community needs and no agreed upon plan. So far, this is what we've done. For the first short-term outcome, we have completed that. Myself, the independent facilitator, has been available, and we've completed a number of activities to ensure that I was available for the entirety of the group's need. An indicator for this being met is that the UNH MACD PP program, a student appointed as an independent facilitator. For short-term outcome 2, improved knowledge of shared needs, again, a number of activities were completed. And an indicator of this being completed was that key informant interviews, the KIs, and focus group discussions were conducted and results were shared to the group. And on the right, you can see myself and David McPherson of the Alexander Eastman Foundation announcing the surveys constructed to the Derry Town Selectmen. For short-term outcome 3, improved knowledge of community needs, the indicator was that community surveys were conducted and results were shared. This was all completed, and we got about 873 responses. And after data analysis, results were shared to the group and a report was developed for the group. Short-term outcome 4 is the last one that has yet to be completed. This is due to the fact that the meeting for the budget isn't until August. So that is many months away at this point. And focus of the group has changed from the construction of the facility to trying to find new ways to get these organizations to work together. And we're still waiting on some decisions by the school board and the YMCA on other facilities that they are working on as well. So a few things were foundational for the success of this project. The two main ones were the time of the organizations involved in their staff. Without them being there, none of this would have mattered. We wouldn't have been able to understand what they actually needed and what their users needed, as well as documents regarding previous meetings before I was implemented as an independent facilitator, and documents regarding issues faced between the groups and the residents of the greater Derry area. Now, here's some lessons learned. First of all, communication. Stable and continuous communication are essential in community development and in any field. Without that, you really can't get anywhere. And to aid this, hosting regular open group conversations where anyone can talk about the needs that they want to talk about aids progress. It aids it greatly. And the more perspectives you hear from, especially in these regular open group conversations, the better. The more voices you have, the better. And resiliency. Throughout this process, as I said in the beginning, I had to really push myself to stick to it and to be patient while I was waiting to find a new project to work on. And it worked out. And I think this is important in community development practice, as if you're not patient and you don't just keep pushing forward, you're never gonna get stuff done. It's not an easy thing to do. And also, the importance of accessible and accurate information. There were many times throughout this project where I really had to search very, very hard to find information on towns and organizations that they were public, but they weren't accessible. They weren't accurate at times either. So there was a lot of things that had to be go through hours and hours of research just to find one simple answer. And finally, the importance of working with organizations. This goes back into communication as well. you need to have these organizations with you if you're going to have these open group conversations, if you're going to try to progress, because without them, you're not really going to know what a lot of their users need, what kind of information they've found, and what they know. Working together is always best. I'd like to thank the following people for helping me through the journey of completing this project, either academically, professionally, and or socially. Thank you all. Thank you.
Thank you, Chase, for your presentation, very comprehensive. And we would like to open the floor for any questions for Chase.
Yeah, hi, Chase. Good to see you. One quick question, really, and it was implied throughout your presentation, but you never really said much about it. And that is ultimately for the town, the question is, where would the money come from, right? And the implication is, well, we might have to raise taxes. I'm wondering how much that was part of the internal conversation and discussions you had with people around the implementation of the project, and whether you see that as actually the major impediment to going forward.
I wouldn't call that the major impediment to going forward. They discussed early on that they did have some extra funding from taxes that were left over that they were looking to move to possibly fund this kind of project. That was a concern that was raised by some citizens that took the surveys, though, that they didn't want their taxes raised to be able to fund this. But it really didn't get into that part yet, because the report that has been developed that's going to be presented in August to the town selectmen was originally meant for the budgeting process to create a better understanding of how much it's going to cost. But due to the fact that focus has shifted and we're waiting on decisions made by the school board and the why, we still don't know the cost. So the idea of funding through taxes hasn't really been raised much yet.
Okay, thank you.
By the way, Michael, Beverly Donovan, the person who responded to Chase's email, because Chase was like trying to look for a new project. He just sent out emails. Beverly Donovan was a graduate of the CED program. So it's a very good kind of like coincidental thing that a graduate of another program is actually opening doors for a soon-to-be graduate of the MCD program. Yeah.
Well, I think too, one of our other graduates is either town manager, assistant town manager, Chase, Andre Guerin. Is he still in Derry?
I'm not 100% sure with that. We didn't really work with the town directly, other than with Beverly Donovan.
Okay, good, got it.
What do you call it? Again, another thing that I like to highlight with Chase's project is that it took some time. He started with some other project and spent like a month and change, right, Chase, and then eventually landed with this other project, which is again very not like in all cases, but it's not uncommon for our MCD students to launch into something, but will have to be redirected into something else, because what the MCD program in Carsey is trying to do is to reflect reality. That, there could be intentions to make change in a particular area, but if resources, wherewithal, or intentions are not ready, or as they say, stars are not aligned, then things will not happen. But it is, as Chase himself said, that the virtue of patience and to stick to what you want, to something is what really matters when it comes to these types of projects. And if you could just imagine Chase being able to get almost 1,000 responses out of a survey that he created, and just utilize the organizations to help administer. But at the end of the day, I mean, you have almost 1,000 voices saying that this is what we actually need in the community. So any other questions, folks, for Chase? Any comments to his presentation?
Yeah, Melinda has a question.
Go ahead.
Okay. So Melinda just says, great work. You mentioned the importance of working with organizational partners. Did you notice any differences among organizations while working with different types of organizations, i.e., government, nonprofits, schools?
I mean, one of the big differences is their focus on who they're serving. I mean, schools focus a lot on obviously younger parts of the population, whereas nonprofits have their own sector that they focus on, whether it being disabled individuals or veterans or whatever. And then obviously the government try to focus on all of them. So a lot of the difference also is funding as well, because the government comes from taxes, schools come sometimes from taxes, but charter schools also could come from taxes, but could come from tuition. And then nonprofits come from a wide variety of funding. So a lot of their difference really was their focus on how they were going to be able to do this.
And I guess, having a common understanding of needs help. Isn't it? The communication part is what you provided, but the collaboration has to come from them. Isn't it? At the end of the day, is their willingness to work together, despite the fact that they have different audiences. There are overlaps. There always are overlaps in terms of who they serve, what they serve, and what they intend to achieve with the communities that they serve. So I think that was one of the big things about your projects, that we were able to maximize these common interests for people to sustain their participation in the project. As you said, without them, this project would not have forwarded. Every time you called for a meeting, every time you asked them for forums, etc., to help you with your survey, well, if they were not interested, if they would not have seen how their own interests would have been served by a common interest, then it would not have pushed your project towards the results that you have. So thanks, Melinda, and thanks, Chase. I would now like to open the floor for any comments to anyone, even and for your students, anything that you want to say. This is where you are going to say it. I would like to invite our alumni who still are here. And by the way, thank you so much for showing up. I know this kind of like relieves some of your painful memories, not really, or celebratory memories of when you were presenting your project. But please feel free to chime in and let us know what you think, or any questions that you want. Go ahead.
Right, Mahmoud, you have your answer.
Hello, I saved my question. This question I had for Miriam regarding the adolescent girls in Haiti. I was more curious to know or give some examples how the male figures were positive contributors to the young adolescent girls who you were trying to empower for their future, and how they can take ownership and be empowered and develop their own, take a role in developing their futures. How the male figures were positive contributors and what roles did they play? And also, how did you get the gang leaders to also be positive contributors, apart from seeking permissions to allow you to conduct the type of activities that you wanted to conduct? So it's a loaded question, but I can ask it again if you need me to.
Thank you for the question, Mahmoud. I'll start with the first one related to how do we engage male counterparts. I have to say that when when Hagen started working 8 years ago, there were no boys or men participating. And over time, from the conversations that we've been having with the young leaders and communities, we started more and more engaging not just boys, but also men and elderly members of the community of the male sex. One of the things that that came from the survey also, when I was asking the respondents why they thought that there was a lack of participation and engagement of young women, and how to support their participation. Some of the answers that I got was that beyond the fear, which was pretty general, but there was also the fact that they thought that the girls or young women's partners
or spouses or parents would not allow them to actually engage in the communities. One of the intermediate outcomes that came out also of the research, including the focus group discussions, was the fact that young people mentioned that there was a lack of responsible fatherhood. And that's something that they felt was anchored in the fact that most of the young people, especially the ones engaged in gangs, did not even know their father. So that would assume that they're not playing a role in actually their children. And one of the short-term outcomes in the project, also beyond the fact that doing the community dialogues that we're actually planning now to have open conversations between those different groups within the community, meaning the girls and the boys and the leader, be the brothers and young gang members that are actually members of the community. But there was also one or two short-term outcomes that are focusing on boys and young men specifically. And what those short-term outcomes are hoping to accomplish is to give them an opportunity to develop that different perspective in terms of their self-worth and what it means to be a boy, what it means to be a man, what it means to be a head of household. So that's one outcome of the project that the project is looking at engaging them more effectively. Another aspect also is in building synergy with other programs. For instance, there is a program called, there is actually a movement called He for She, which is a global initiative that promotes the engagement of young male toward supporting empowerment of adolescent girls and young women in the communities or globally. So within that movement, there was also a short-term outcome that is looking at engaging them to take initiative, because through that movement there are a lot of tools that are available. Of course, they're not in Creole. That's one area where we need to actually bring a contribution, but that is looking at really giving them effective tools so they can actually start taking initiative, not just toward the girls, but also toward engaging other young men or the young people in the communities. Another aspect that is very important to look at also that I learned from the document review is also the cross-generational divide, especially with regards from the religious perspective. So I'm not there yet, but definitely when we're talking community dialogues, one, it's very important to remember and to keep in mind that not only between the different sexes, not only between the different generations, but also from the religious perspective, especially since Haiti is a very religious and culture, religion is a very strong part of the culture. With respect to your second question, I hope
I will have to cut you a little bit, Miriam, just to make sure. If it's okay to respond to it, but if you can just like limit the amount of time, only because it's 8:06, and I would like, we will still meet with you after like for 5 minutes. Go ahead, please.
I'm sorry, feel free to email me with any questions if you have any, because when I get started in that subject, sorry about that, Jolene. For the gang members, it's very challenging, because the thing that, one of the main reasons why they allow the project to be implemented is because they derive some kind of prestige, because this is a new resource that is being contributed toward their community. Now, in terms of actually contributing, I cannot say that there is a very positive aspect in that regard, because they're mostly looking at what they can gain. So their understanding is that, just the fact that they're allowing participants to participate in that project is one thing. But I have to say, from my experience, the fact that they are not putting pressure on the project itself to engage their own participants, because elite capture, this is a very difficult thing that usually in project implementation that communities are facing. So I have to say that, the fact that we're not having any pressure from them for elite capture is already a positive thing. And I do not know how things are going to go along. We're going to continue and moving forward with other short-term outcomes. And the hope is that really that they will not really start noticing the change that we're hoping will happen from the young people, that we're hoping to really start putting distance from them. So that's what I can say for now.
Thanks so much, Miriam. Just quick comments here from the audience. First, from Khalid Mustafa, excellent presentations and great work. I am thankful for the opportunity to learn from the wisdom. Special applause to Miriam, who was originally part of our cohort. And Melinda says everyone did an excellent job. Kudos. Scott Eagleson said creativity, intelligence, and open communication. Congratulations to all. Our world needs more of you. Very nice words, Scott. And we, Sanjeev and I, definitely echo the sentiment. As you already have seen, folks, I'm speaking to the audience now, that the amount of learning that Sanjeev and I get from the students is immeasurable. When, as Michael said, the realization that 8th grade is a time for transition, etc. I never thought of it. These are examples, and what Madison have shared, Rebecca has shared. Same thing with what Chase said, Miriam said, and also with Bienfit, that we have been learning from them. So Sanjeev and I would like to thank you for the opportunity to be able to share what we know, but more importantly, for you to be able to share with us what you know, very much appreciated. At this point, I would like to turn it over to Michael and Sanjeev for some closing remarks. And then, folks, at least the students, if you don't mind just staying behind for 5 minutes, this is the last time ever in your life that you're going to hear Sanjeev and I say 5 more minutes. But before that, Michael first, and then Sanjeev. Go ahead, Michael.
Yeah, just thanks again to everybody. The presentations were really interesting today, and I wish we had more time for questions, but really appreciate the time and effort that everybody put in, and congratulations to everybody.
Thanks, Michael.
Thank you.
Robin, I forgot Robin. Sorry, Robin. Anything you would like to say, or Sanjeev? Go ahead,
Yeah,
please.
absolutely. No, I'll say, I'll just say first, and then I'll let Robin do the closing. Yeah, absolutely. I mean, I agree. With everything that Jolan and Michael has said. Congratulations to all of you. It's a privilege for us to be working with you, even though we may look like career instructors, but we are, like we say, partners in your project, and so it's a privilege. It is a privilege, and congratulations, and thank you everybody for celebrating these achievements with our students. Robin, over to you.
Well, truly inspirational. Every one of them, I have been in your seat. I went through the program. I was in the first cohort, and so I know the work that goes into this, and just remarkable, really, really remarkable, and such impactful work. So thank you for really doing the hard work, because you are really what is going to be changing our world. All of you. So thank you so much for all of your hard work and your persistence.